Hi, so my name's Joanne. I'm currently a psychologist within Youth Justice in the Allied Health team called Youth Justice Assessment and Intervention Services. I've been in my current role to different degrees for about the last 5 years. I have taken on some roles elsewhere outside of the justice system, but before I came into Youth Justice, I did have some placement experience with adult forensic mental health services, and I've also worked within child protection and private practice. So in terms of when I started working in the criminal justice system, I would say that I had something of a realistic understanding of what the work would involve because I'd had previous placement experience within forensic mental health. That being said, it was a different age group and a different demographic of clientele. So I would say that my understanding of what youth justice would be like was based on a number of different other experiences that I'd had that I pulled together to help inform my expectations around what it would be like to be here. Having now been in this space for a few years, I would say that probably coming in, my understanding of what it would be like was a bit more intellectual in that I understood conceptually, what the work might be like, what the clientele might be like, but in terms of how that would feel for me as a worker and what it would be like day to day, particularly being based in an institutional environment, how challenging that could be in lots of different ways. So when I say conceptually, versus the lived experience, what I really mean is that I, hadn't experienced yet the kinds of ethical dilemmas that I might face as a practitioner, the level of behaviours of concern that I might be working with, or the complexity of the client's presentations from a clinical point of view. It's very different, I think, to base an opinion or to understand a case based on written information versus what it's actually like witnessing their behaviour and actually working with them therapeutically. The supports that I've found to be helpful in my work so far have really been a combination of things. I'd say that there's not any particular one thing that actually is sufficient on its own. Something that I have thought a lot about is through being an allied health professional, the advantages that you do have in terms of accessing regular clinical supervision and peer supervision. So for me personally, through my role and my line management structure, I do have access to clinical supervision. However, I do also access group peer supervision with the therapeutic services area, and I do also have peer supervision through other professional associations that I'm a member of. So for me as an Aboriginal psychologist, I'm also a member of the Australian Indigenous Psychologists Association, and I'm a member of the Indigenous Allied Health Association, and I have contact with people through both. I do have monthly supervision with other peers as well, and I find that really useful. I've also accessed the Employee Assistance Program at different times during my career so far, and I would say that while I understand it might be kind of stigmatised and people might avoid accessing those services for different reasons, I've found it to be really helpful to have someone who might even understand the space that I'm working in, and obviously having seen other psychologists for EAP, that's been really useful for me. Informal supports are really important as well. So I do have family members who might work in related areas or have experiences that align. And so even though I can't talk about the details of everything with them, I can maybe in general terms talk about some of the challenges I'm facing. And I really appreciate all different versions of support, including cultural and personal support within that. I have to admit that as an allied health practitioner and as a psychologist, there's a particular, a particular way that we, can experience vicarious trauma. And part of that is because the nature of our job requires us to talk to young people or to talk to clients about traumatic experiences and really difficult things that they've been through. So in terms of how that's affected me, I would say I have noticed at times when I've been basically feeling overloaded with lots of details about a young person's traumatic experience or a client's historical experiences of neglect, abuse, different kinds of trauma memories that we might have been trying to work to process. All of those things at different times I've noticed have basically stuck in my own brain a little bit. And that's how I've talked about it in supervision or talked about it through accessing formal support like EAP, is I've had trouble, maybe switching off from that particular story, or I have found myself imagining what that might have been like for a particular client, which was really challenging because maybe I see an older version of that young person, but because maybe I've gotten to know them as well, I've then been imagining what it was like for them to have that experience. So when I've noticed that and I've talked about it in supervision, sometimes I have made a decision to access further help with that, or made a conscious decision to increase my self-care strategies, or even, again, a combination of things like accessing the employee assistance program, talking more to my peers, or even taking some time off to help me just have a little bit of a break, because that can be another risk, is actually not taking time off to process things that you need to. The advice that I would have for people who are entering the criminal justice system as employees and people who are interested in the workforce would be to be really vigilant around your own needs, because you might have heard people say already that you can't help someone else if you haven't addressed your own needs first. And I think that's really true, especially when there can be cumulative impacts of the stress, and you might notice that there's been multiple things that have happened. Then over time, it's gradually affected how you're feeling, or perhaps how you're even interpreting things around you. So the advice that I would have is to develop a self-care plan, develop an understanding of your own warning signs when it comes to stress or when things might be changing in terms of your own well-being, but also not to be afraid to talk to others about it, because these support mechanisms, whatever they might look like for you, they're there for a really good reason. And that's because there are, I think, inherent psychosocial risks within this kind of workplace. And it's by nature of the kind of population that we work with, but it's also by nature of working within an institutional environment that can be really challenging.